Anal cancer is a rare type of cancer that occurs in the tissues of the anus, the opening at the end of the digestive tract through which stool exits the body. It typically begins in the lining of the anal canal, which is the passage connecting the rectum to the anus. Types of anal cancer. The majority of anal cancers are classified by the type of cell in which they originate. 1. Squamous cell carcinoma. The most common type of anal cancer develops in the squamous cells lining the anal canal. 2. Adenocarcinoma. Arises from glandular cells in the anal region. Rare but may occur in association with fistulas or other anal gland conditions. 3. Basal cell carcinoma. A very rare type found in the perianal skin. 4. Melanoma. Rare and aggressive, arising from pigment-producing cells in the anal region. Risk factors. Several factors increase the risk of developing anal cancer. 1. Human papillomavirus, HPV. The strongest risk factor, certain HPV strains, especially HPV-16, are linked to anal cancer. 2. History of anal warts. Caused by HPV, anal warts, condylomas, can increase the risk. 3. Weakened immune system. People with HIV/AIDS or those on immunosuppressive medications, e.g., post-organ transplant, are at higher risk. 4. Receptive anal intercourse. Increases exposure to HPV. 5. Smoking. Tobacco use is associated with an increased risk of anal cancer. 6. Age and gender. More common in individuals over 50 and slightly more prevalent in women. 7. Chronic inflammation. Conditions like chronic anal fissures or fistulas may contribute. Symptoms. Early anal cancer may not cause noticeable symptoms, but as it progresses, the following signs may appear. 1. Bleeding. Rectal bleeding, often mistaken for hemorrhoids, is a common symptom. 2. Pain or pressure. Discomfort in the anal or rectal area. 3. Itching. Persistent itching or irritation around the anus. 4. Lump or growth. A noticeable mass or swelling near the anus. 5. Changes in bowel habits. Narrow stools, constipation, or changes in stool consistency. 6. Discharge. Unusual anal discharge. 7. Swollen lymph nodes. In the groin or anal area. Diagnosis. Diagnosis of anal cancer involves 1. Physical examination. Digital rectal exam, DRE, to check for masses or abnormalities. 2. Anoscopy. A small scope is used to inspect the anal canal. 3. Biopsy. Tissue samples are taken to confirm cancer. 4. Imaging tests. CT, MRI, or PET scans to assess the extent of the cancer and check for spread, staging. 5. HPV testing. Identifies the presence of high-risk HPV strains. Stages. Anal cancer is staged based on tumor size, lymph node involvement, and metastasis. Stage 0. Abnormal cells are present but not invasive, carcinoma in situ. Stage I. Tumor less than or equal to 2 centimeters in size, no lymph node involvement. Stage 2. Tumor greater than 2 centimeters but no lymph node involvement. Stage 3. Tumor with local lymph node involvement or extension into nearby tissues. Stage 4. Cancer has spread, metastasized, to distant organs. Treatment. Treatment depends on the stage and type of anal cancer. 1. Chemoradiation therapy. A combination of chemotherapy and radiation is the most common treatment for anal cancer. Chemotherapy drugs like 5-fluorouracil, 5-FU, and mitomycin are used. 2. Surgery. Rarely the first choice, but may be needed for residual or recurrent cancer. Local excision. For small, localized tumors. Abdominoperineal resection, APR for advanced cases, involves removing the anus and rectum. 3. Targeted therapy or immunotherapy. May be used for advanced or recurrent anal cancer. Prognosis. Early stage cancer. High cure rates, especially with chemoradiation. Advanced cancer. Prognosis depends on the extent of spread, but newer treatments are improving outcomes. Prevention. 1. HPV vaccination. The HPV vaccine, e.g., Gardasil, significantly reduces the risk of anal cancer. 2. Safe practices. Using condoms and limiting the number of sexual partners reduces HPV transmission. 3. Routine screening. High-risk individuals, e.g., those with HIV or a history of anal warts, should undergo regular screening. 4. Smoking cessation. Reduces the risk of many cancers, including anal cancer. 5. Healthy lifestyle. Maintaining a strong immune system through good nutrition and exercise. Early detection and treatment significantly improve the chances of successful outcomes in anal cancer. If symptoms persist or risk factors are present, consulting a healthcare provider promptly is essential.